Hello everyone, we are Team MASA. Very glad to be here. And what we are designing is a melanoma alert app. My name is Yishan Li. I'm a currently PhD student in cancer biology at Emory University. I have extensive background in biomedical research and bioinformatics. And I also am a co-founder of a startup company, which is a website that serves the elementary school education in China.
Hi everyone, my name is Pragati. I'm a first year MPH, Master of Public Health student at Emory University. I have a BS degree in computer science. It's been my dream to always apply technology to medicine and healthcare. And me and Yisheng, with his already earned MPH and my currently earning MPH, are trying to improve early detection and prevention. We're starting with cancer, but melanoma specifically.
Okay, quick question. How many of you have met someone in your lifetime have cancer? So think about it. If there is a tool for early detection of that cancer, will that person getting better? So melanoma has been a critical issue for public health in the United States. And early detection of melanoma will increase the 5-year survival rate from 15% to 75%. And based on our 194 customer validation, we have estimated our market size with a total available market as $2 billion and serve available market at $720 million and target market at $55 million. So target market will be the US female population with a history of health skin issue and constantly check their moles. With a subscription, with a $12 annual subscription, and based on our statistics, we identified those numbers. And to enter the target market, we decided to start from small. So our market would be the Atlanta city. So Atlanta is a city with one of the highest index in the United States. And there will be a higher melanoma incidence rate in Atlanta. And also, to expand the target market to serve a available market, we're going to partner with the American Cancer Society through the Sling Health network, and to have those family members of patients enrolled in the serve available market. So we identified and validated our problem as female young adults ages from 20 to 29 with skin health issue history and want to determine their relative melanoma risk because of early detection saves lives. In the 94 face-to-face interviews, 67% of them reported that they want to know their skin cancer risk. So, such as, my grandma had melanoma and I want to know my skin cancer risk. Or I had eczema when I was a child and went to beach a lot, so I care about my skin status. So, our solution is a real-time, comprehensive risk assessment integrated into an app. So, we aim to replace the current methods, including the self-examining techniques, and another 36 current apps that track moles over time, which none of them provide a real-time assessment, risk assessment. So next I will let Pragati to introduce our solution.
So the real problem with allowing people to just check their moles is that they forget and they don't really know what to look for. So we wanted to create this technology that a person would be able to take a picture of their mole and actually get a real relative risk assessment. We've decided the model of our solution to include the picture of the mole, and as well as the demographics, because that greatly matters: age, sex, race, and the city in which you live. And we want to be able to provide a real-time risk assessment in this application. We also hope to collect a bunch of images so that we can get our patients to the doctor sooner. At the end of the day, we're not trying to replace dermatologists. We just want people to go see them quickly. So this is the AI portion of our application. We got these images from a skin cancer database These are melanoma images, and there are also non-melanoma images. We put both of these trained TensorFlow software, and so we get our trained algorithm, and so we're able to put a user's image into the algorithm and then get a melanoma relative risk score. So this is an example of what a user would see. They would take a picture like this. This is a biopsy-confirmed melanoma that is not part of the training data set. It's a test image, and so our algorithm outputs within 30 seconds. The closer to 1, the more likely to be melanoma, and so here, obviously, the user would see something like this, encouraging them to go see a dermatologist. This is a nevus, so it's a benign lesion, but it gets a kind of medium range score, about 34%. And so this is super crucial because we want people to get their early stage melanomas diagnosed. So this would encourage them to go to monitor their mole and consult a PCP. And this is a benign nevus that got a super low score, so then our user would be encouraged to check another mole. And so through our milestones so far, we've talked to almost 100 patients. We first started with older cancer patients, soon realizing that younger people do care about their skin cancer risk. And so that's why we decided to focus on them as our target population. And then we've done a lot of testing in order to understand what the UI should actually look like, what the users should actually see, and that's why we decided on the categorized levels. So our current leads are developing the front end, we're working on the back end right now, that's what I'm doing. And so we want to move forward by creating the front end interface, and then we also need more access to skin lesion data banks because melanoma isn't the only skin cancer that exists, so we'd like to expand our range. Our advisors, we've been working with a few people at Emory, Winship Cancer Institute, and Georgia Tech. We have a great biomedical imaging faculty member jointly appointed with Emory and Georgia Tech, who's helped me a lot in training. And we have actually the psychiatrist who does curate the image data bank has worked with me, trying to get images to me. And so Yisheng has spoken with a teledermatologist at Winship Cancer Institute and dermatologist in China. And lastly, we've done most of our customer interviews and market research through the accelerator that we're in. We're part of the first cohort of the Emory Startup Accelerator, and they've been a huge help to us. So I think with these resources, we want to move forward in creating the front end of our application in order to detect cancer early. So, thank you.